All right, so I seen some videos where there were like physicians, cardiologists, or like neurosurgeons saying, as a neurosurgeon or as a cardiologist, I would not do what? And insert activity or whatever it happens to be. So, for example, a cardiologist has said they would not smoke or drink alcohol because they're cardiologists and they understand how the heart works. Or a neurosurgeon may say, I may not drive a motorcycle because they see different things. So, we're going to do the nurse edition of that. I would love to see or hear what you all would not do as a insert specialty. Um, so maybe we can all learn a little something about each other's specialties as a result of what you've seen in your work environment. So as a OB nurse, as an OB nurse, I would say that I would I would never, but I would make sure I have real family planning in terms of spacing my children. We see, or I have seen moms come in, with babies 9 months apart, or what we call Irish twins, or having baby year after year after year. And I'm not knocking it in terms of how you want to reproduce and how to have your family, but it does take a toll on the body. And it really takes about a good 9 months to a year to heal between pregnancies. So, what we are seeing is that we have increased risk for hemorrhage, increased risk for premature birth, and things like that when people are not having good family or not having good spacing between their pregnancies. So that's one thing I wouldn't do. And the second thing I wouldn't do, if I have had C-sections, I would make sure I would try to limit my C-sections to no more than 3, because every time that they go in and do a C-section, we have what's called like a potentially a uterine window where the muscle is so thin that you can see through it sometimes. And it's just not safe, because you could be at risk for uterine rupture if you have more than 3 C-sections. Now, I'm not saying that people don't have more than 3 and that they don't do fine, but we're talking about evidence-based practice and what research indicates, not just, not just because, well, I had 5 C-sections and I did just fine. That's good for you. But we are talking about the rule and not the exception. And again, I do this based off of research. So, what are some things in your specialty that you would say that you would not do as a insert specialty?